So coming to the today's topic, which is blood pressure tracking dashboard. So we'll look into it. Why this is useful, blood tracking blood pressure dashboard. And the first purpose is to track blood pressure data in a modern way and for informed decision making. That is the first thing. The second purpose is to keep historical data and use for policy actions or direction. And the third purpose is to make trend analysis. For whom? This is for all health organizations, including hospitals and Ministry of Health, as well as for health professionals. If you know someone in this sector, please share them now. What does it track? It tracks number of patients, for example, and systolic and diastolic data. In the case of this, for example, in systolic, normal and above normal data. Similarly, for diastolic, normal and above normal data. In this case, for 2 years, for example, and it also tracks the proportion of normal and above normal cases. In the case of uh, systolic, 70% are normal in this particular case, and 30% are above normal. And for diastolic, 78% are normal and 22% are above normal. Just from this demo data, it also actually show us the data by age categories in 10 intervals for both systolic and diastolic. You can see the data by different slicers. In this particular case, for example, you can see data by year. You simply have to click on the year of your preference, and you can also see by month. So in general, you'll get this beautiful blood pressure dashboard. So this is data entry. First, you'll insert your institution's name. Then here is the standard for systolic and diastolic, and then you will insert the data in the table. The first one is the date, then the physical year, then the customer name or patient name, the age, the recordings of systolic and diastolic data, then the heart rate, then the physician who examined the patient, and then the status for both the systolic and diastolic will be automatically updated. And in the systolic and diastolic, you can see the red colors, which is automatically just populated when the numbers are actually above the standards. So from this table, as you insert this table, you'll get the dashboard. So from if you insert the data in the previous table, and then we'll get again the dashboard like this one. For example, if you see the data by slicing, in this particular case, for example, if you slice by year to 2021, in this demo we have total patients for systolic. Normal is 3, above normal is 1. For diastolic, normal is 3 and above normal is 1. For proportion for systolic, normal is 75% and above normal is 25%. For diastolic, similarly for normal is 75% and above normal is 25%. With age categories in both cases, those patients are in the age category of 70 to 79. You can also select the month if you like. And so this will be a very interactive dashboard. If you like this video, please subscribe and share.